Come in.
Hi, my name is Ellen. I'm going to be your nurse for today. Can you tell me your name and your date of birth?
Anita Beth, the 2nd month, the 14th, 1968.
Alright, Anita Beth, I'm going to wash my hands, close the door, and provide privacy. Do you have any privacy concern?
No.
Alright, Anita, I'm here to administer a medication through your IV line. The medication is magnesium sulfate, 35 milligrams. Is it okay?
Sure.
Alright, I'm going to the medication room to gather my supply and be back. Alright, in the medication room now. This is the medication the doctor has provided. So I'm going to check for magnesium sulfate. So, okay. Make sure. This is my medication. I want to, the first dose, I'm doing my first check. The patient name is Anita Beth in the MRI, and then I check the medication. It's the same name. The medication is magnesium sulfate 35 milligram IV. It's the same magnesium sulfate 35 milligram IV. And then I checked for the expiration date is 2024 July. It's the same time. I checked the patient chart, and the patient is allergic to penicillin. The time the medication is supposed to be administered is 2 p.m., which is now. So I'm going to make sure, get my medication. I get this medication is right here. Get my 10 milliliters syringes. Right here. I got the needle I'm going to be using is 3 milliliter needle. That's the one I'm going to be using. Alright. I'm going to wash my hands. Put on my glove. That's the glove I have. I check the medication for clarity. Color change, no color change. The medication is clear. Since I get the needle, I'm going to do my dosage calculation. 35 milliliter. When I check, it's the same. Infused over 30. They said 1 week. So 35 milligram divided by 60 times 2. 35 divided by 60 times 2. I get 1.16. So I'm going to round up to 1.2. So I get 1.2 milliliter. Now I'm going to I checked my dosage calculation is 1.2 milliliter. I'm going to remove the needle. No. There's a fluid in this needle. Alright, I'm sorry. I'm going to remove the cap. I'm going to infuse 1.2 air into this. Okay, this 1.2 right there. I'm going to infuse the air. Oh, before I infuse the air, I'm so sorry. I'm going to open the valve. The valve is already open. I'm going to take my alcohol swab. Cleanse the valve for 30 seconds. Okay, trash. Allow it to get dry for 15 seconds. Alright, it's already dry. I'm going to infuse the air into this valve. The air is there, and then I'm going to remove 1.2 milliliter of magnesium sulfate. So that's 1.1, 1.2. So my medication still 1.2. Gonna cover the needle. It's covered. Gonna label it. I already did. The label said magnesium sulfate 35 milligram IV push. So I get my stuff. I already get it. Now I forgot first to prime it. I check in the syringe. I'm going to take off the bubble, making sure no bubble. Alright, there is no bubble. So I have to do my second medication check before going to the room. This magnesium sulfate, 35 milligram IV push. The patient name is Anita Bath. She's allergic to penicillin. And the time right now is 2 p.m. That's the time the medication is supposed to be infused in the patient's body. And then the expiration is July 2024. It's not expired. So I gather my supply, got my alcohol work. So I don't have gauze, so I'm going to use gather my alcohol swab, my 10 milliliters syringes and my medication back to the patient room. Before I go to the patient room, I gotta remove this glove. I'm so sorry. I got a new glove. This is my new glove. 10 milliliters syringe, my needle plus my alcohol swab. Nah.
Come here.
Hi, Miss Anita. I'm back to administer your medication. Can you tell me your name and your date of birth?
Anita back the second month, 14, 1986.
All right, I'm gonna place my stuff over here. Anita, I'm here to administer the medication, which is magnesium sulfate 35 milligrams to be infused in your IV. Is that okay?
Sure.
All right, I'm gonna put the bed up to my heart, and then I'm gonna put the wheel down. First, I'm gonna wash my hands. I'm closing the door to provide privacy. Do you have any safety concern?
No.
All right, Anita. I'll wash my hands. I'm going to put on my glove. And now I'm about to do my 10 medication check before I administer the medication. Can I see your wristband? This is Anita Bar. The medication is magnesium sulfate, 35 milligram IV. The patient name is Anita Bath. She's allergic to penicillin. Today's date is July the 25th, 2024. That's the expiration date for the medication. That's the time it's supposed to be expired. And the time the medication is supposed to be administered is 2 p.m., which is now. All right, Anita. So I'm going to cleanse. Gonna cleanse the IV stuff for 30 seconds. Allow it to dry for 15 seconds, which is clean. I'm gonna clamp this over here so it's dry. Open this, so I'm gonna inject air into this. I'm gonna flush air. 5 milliliters of air into this, and 5 milliliters of flush. Normal sitting. Let me show. Okay, 5 milliliters normal sitting. So it's 5 milliliters. And then I take a clean glove, wet 30 seconds, and allow it to dry for 15 seconds. Gonna remove the needle. Okay, so this will not touch the patient's skin. Oh, I'm sorry. Okay, I remove the needle. It's already dry. So this is 1.2 milliliters. So I'm going to take 1 minute, 1.30 seconds to flush, to inject the needle injection in it. I'm looking at my time. Is that 1 minute 30 seconds? All right. So I have to flush for the second time. So I'm gonna wet 30 seconds. That's new alcohol swab 30 seconds. I'm gonna allow it to dry for 15 seconds. I open up my cap, my flush. I'm gonna flush for 1 minute 30 seconds. Looking at my time. Alright, flush for 1 minute 30 seconds, and now I'm gonna unclamp this and then clamp it back. While doing the flush, I'm checking the skin for any redness, any pain. I pop it. Do you feel any pain? Alright, no pain. I take my stuff, I trash it. After I trash it, I remove the glove. Wash my hands. Anita, Ba, do you have any concern?
No.
Is there anything else I can help you with?
No, I'm okay.
Alright, I'm done with my IV punch. Nah.
Come in.
Hi, my name is Ellen. I'm going to be your nurse for today. Can you tell me your name and your date of birth?
Anita Bath, the 2nd month, the 14th, 1986.
Alright, Anita Bath, I'm here. Your doctor has ordered me to do dressing change on your central line. Is it okay?
Yes.
Alright, I wash my hands. I provide privacy. Do you have any safety concern?
No.
Alright, I check the environment. There is no safety concern. Alright, Anita, I'm going to be back. I'm going to gather my supply. Alright, in the education room. So I get this supply. I get my glove. Nah.
Come in.
Hi, my name is Ellen. I'm going to be your nurse for today. I'm back. Can you tell me your name and your date of birth?
Anita Bath, the 2nd month, the 14th, 1986.
Great. Anita, I'm going to close the door and provide privacy. I'm going to wash my hands. Then I'm going to raise your bed up to my heart and then lower the wheel. Alright, Anita, I'm about to change your dressing because that's the one the provider has ordered. Is it okay?
Yes.
Alright. Miss Anita, do you want a mask to wear?
Yes.
Alright. I know my mask. I have a clean mask. So I put on my glove. So the next thing I'm gonna do, I'm gonna check your central line to make sure no redness, no dryness. So I have an alcohol swab. So I'm gonna remove this dressing. It expired. I'm sorry. Oh. I'm sorry, Professor. This dressing don't want to move. You ready? I'm gonna remove the tip first. Alright. So, Professor, if I remove the entire tip out, this stuff gonna be pulled up. Okay. So I just gonna pretend that the needle is still in there because the tip removed it. So I'm gonna toss. I'm gonna trash this. I'm sorry, that's not a real human being. So, okay. I'm not supposed to touch it, but it's trying to come up. I am so sorry. Okay. So I removed the tip already. I'm gonna change my glove. I'm gonna change my glove. Toss it. Wash my hands. I'm about to open up my central line kit. I open it away from me. I just don't want. Alright, it's open already. I already get mask. So the central kit. How do I get this stuff? So I get my glove off. Alright. So now let me see how to. I'm not supposed. Actually, I didn't supposed to touch it, but I don't have space. Okay, I can come over here. The first one I'm gonna do. Pinch it. on. I'm gonna gather. This is my chloro prep. I prep it. I get this Clan. I can either use this or I use the alcohol swab. And then I have this skin prep over here. And then I'll get this. So I just want to dress it closer. I'm sorry. And then this is my packaging. I'm just open it just in case. Again, my packaging is right here. Alright, get this chloro prep. I'm gonna hold this. I'm sorry because I don't have like an action. So now I'm gonna wipe. I wash this. I let it. Alright, it's already dry for 30 seconds. So I'm gonna release it a little bit. I'm sorry because this is not sticking. I released it. This is my chloro prep. So I pull the chloro prep around here. Oh Jesus, I'm sorry, it keep coming up. I just gotta pull this. You gotta about to put the dress on it. Please. I'm gonna clip this and hold it with the skin a little bit to see if it can stay in place. Oh, Jesus. I'm sorry, Professor. I just don't. Okay. You can stick. I'm gonna take my packaging. Actually, it's not sticking, so I have to use my hand to hold it in place. Okay. Now I'm gonna. Alright, my packaging is on this. Peel it up. I'm making sure. Alright. So I wrote my name, my initial, I did, and I'm gonna put this over here. My pen. Hold on a second, my pen over here. So this is my initial. Actually, I'm supposed to do it on the patient's skin, but 7, 25th, 21. Gather all my supply. I'm gonna toss them and then remove my glove. Toss it as well. Wash my hands. Miss Anita Bar, is everything okay? Do you have any concern?
No.
Alright, that's the dressing change, and I'm gonna remove the. I forgot to remove this while I have my stuff. Alright, that's the dressing change that the doctor has ordered. I see you again. Do you want me to close the door?
Yeah, you can close it.
Alright, thank you.